Welcome to HCA Talks Health, brought to you by Health Coaches Academy, the UK's leading health coach training academy. I'm your host, Zena Le Roux, a certified health coach, and each fortnight I'm joined by experts from across the health and wellbeing space to share insights, ideas, and practical tips you can use to improve your health and everyday wellbeing. Welcome to HCA Talks Health. I'm Zena Le Roux, and with me today is Dr. Jane Seghal. She is a GP, she's an NHS doctor, and she's now also working as a health coach. Welcome, Jane. It's lovely to have you.
Thank you for having me, Zena. I'm delighted to be here today.
I'm curious about your own journey and how you decided to become a doctor. So please tell me more about when did you decide or know that you wanted to become a doctor?
Actually, I didn't realize until I was quite a bit older. I went through school, and did quite well academically, all the way through school. And I got to my A levels, and sort of kept quite a broad, sort of, kept my A levels quite broad in terms of what I could do afterwards. And then I think because I'm half English and my dad's Indian, and I think my dad was always kind of in the background saying, do something that you can do something not sensible necessarily, but to do something that was secure. But I still didn't really know at 17, 18 what I wanted to do. And my older brother had done a chemistry degree at Edinburgh University. So pretty much I just copied him. I was doing chemistry at A level, and it sounds terrible, but I literally thought, I'll do that because you can do a lot with chemistry afterwards. You can go into, financial, or you can do science or whatever. And I was quite good at science stuff. So I thought, yeah, I'll do that. So I went to the same university. I went to Edinburgh University and did a chemistry degree for 4 years. And it was during that, in the final part of it, that I was like, what am I going to what am I going to do with this chemistry degree? But I also realized that I got offered to do a PhD, so further research after graduating, and then I suddenly thought, well, actually, I'm a real people person. I need to be around more people. Don't get me wrong, there were people in the lab and they were lovely, but I needed to be around more people. I liked hearing people's stories. I liked listening to people, and just finding out stuff about them. So I kind of just was like, I need something with more human contact and variation day to day. And we'd done a little bit of medicinal chemistry, and I was always interested in biology, although I hadn't actually done that at A level. So yeah, so I kind of thought, you know what, I'm going to apply for, there's some postgraduate medicine courses that you can do in the UK. In fact, there's loads now. So yeah, and you don't have to apply to there's a 4 year course, there's a 5 year course. You don't have to apply to the short one. So I applied to a few different ones, got into them, but decided to stay in Edinburgh, because I was with my long-term partner, who's now my husband. So yeah, did a 5 year degree in medicine, and then that was it. And yeah, I just always had this feeling of wanting to help people as well. And that was really strong. So yeah, and I really enjoyed my medical degree. So that's kind of when I decided. So it was later. And I think it's hard always knowing what you want to do straight out of school.
It is.
Yeah.
Yeah. Okay, so it was only a bit later in life. But if you think about earlier on in childhood, what did you want to do then? Did you have a clear idea of what you wanted to do then or not really?
Well, I did quite a lot of music actually growing up. I'm the youngest of three, the only girl. My two older brothers and we all play violin, piano. I actually had a music scholarship to my school. So I actually thought I would maybe do violin and music. That's what I was
Mm.
quite serious about that at one point. Um, but I also had, as I said, my dad, his work ethic is really strong. I think it's that kind of background for him that he had. And he came to this country he came to the UK when he was like 2, and they didn't come with very much at all. And he worked incredibly hard to provide for us and gave us a brilliant education and upbringing, along with my mum's support. Obviously, she worked really hard too. So, and they didn't have much. So I think in my mind, I kind of wanted to know that I think he'd instilled in us that security and kind of a steady job and hard work was really important. And music at that point, I suppose, felt a bit risky. I'm not saying I didn't do it because of him. I didn't. I would have done what I wanted, and he would have supported me. He's very supportive, and so would my mum. But I think I had that in my mind that I needed something to fall back on, if that makes sense. So music was always kind of like a passion, but I wasn't sure it was going to be my career. In the end, I think I wanted something that was, again, it was more having contact with people. and being able to talk to people and, hearing their stories, like I said before.
Mm. So you knew from probably a young age that you wanted to help people. That's something that you felt
Yeah.
strongly about. And then, so you did your training, you trained to become a medical doctor. And what was your experience like with the training itself?
So yeah, so that was really it was a tough time. I think going from being a medical student to a junior doctor is
Mm.
quite a jump. I think there's now things in place to try and make that smoother, although I think it's still always a hard transition. It does feel like sometimes you're in the deep end quite quickly. And definitely as a junior, so we have foundation year one and foundation year two. I think they call it resident doctors now here. And that's two junior years, and they were really tough. Um, yeah, I'm not going to lie, like you're rotating very quickly from department to department in different hospitals. So you're never really part of a team for very long when you're training. And I think that can be, well, I think, being part of a team is so important, isn't it, for any job, for any job. Like you want to feel included. And it's not that you aren't included, but you're just not there long enough for it to really kind of happen in that way to develop friendships or relationships with your peers, etc. So it was really hard. And I think the staff often knew you weren't going to be there for that long. So I suppose maybe that made it difficult as well. So I would say it was really tough. And obviously you're doing long hours, night shifts, you're learning people's lives and, you're responsible for so many people. So yeah, it's quite a scary transition actually, the first couple of years. Um, but I always knew that I wanted to do general practice. I would have liked being a generalist.
Mm.
And I worked really hard all the way through. No, right from the beginning of medical school, I knew I wanted to do GP. Um, and so then I went into my GP training. But I think alongside my GP training, which was also again multiple rotations through different hospitals and into general practice, we also I had a lot of personal stuff outside that was quite demanding. So the combination of long hours, night shifts, um, perhaps departments where they didn't know you as a person, so they maybe wouldn't know my story, they wouldn't know what was going on, and you weren't necessarily part of the team long term. It was a difficult time for me, definitely.
I've always wondered about, doctors doing such long hours, and then I mean, you need to focus, you need to have a clarity of mind when
Yeah.
you open up or when
Yeah.
you're working with patients. So it feels like it shouldn't be like that.
Yeah, and it was really difficult as well because obviously I was a bit older, having done a degree before medicine, not hugely, I didn't have a massive career in between my chemistry degree and my medical degree, but say the 18-year-olds coming in, because in the UK they can come straight in from UK, from 18, they don't necessarily need to do a degree before. And
Mm.
I would say 23-ish when I started. So when I was coming up through my GP training, I was and after foundation I got married and I was thinking of having kids, and I did. And so through summer rotations, I had a child at home as well. And I think a lot of my peers at that stage didn't necessarily have the same situation. It felt that way anyway. I think it's very different now
Mm.
because people actually chop and change like maybe what specialty they're doing. So some people are coming into GP maybe a bit older now, and but it was also incredibly hard for me to actually work less than full time.
Mm.
Putting in an application to do that it felt like I had to jump through a lot of hoops to get it. And they've actually changed that now. So anyone can actually apply for less than full time. But back then, when I was doing it, you had to have quite specific reasons and I had to be seen by occupational health. And yeah, it was kind of like I felt like it was bad of me to want to do less than full, like, I feel like I was made to feel a bit bad for wanting to do less than full time. And certainly in the actual posts that I was in, um, they often, would say we have a gap in the rota because we've got people who are working only at 80% of the full time.
Mm.
So, like as if that was like a fault or a blame when really it's their responsibility as the employer, obviously, to fill that gap. Like, don't offer that contract if you can't, if you know what I mean. Um, so yeah, and that was awful because they would do that in front of like my peers and stuff like that. So it wasn't an easy time, and I'm so pleased now that they've changed that. And actually, it's so much easier for doctors to apply for that. And I think they have to because when I say 80% of less than full time, that was still some weeks 60 hours. Or if I was on calls, so it was more than like a full time
Okay.
So, it wasn't every week that it was 60 hours, but if you had an on-call week, I could be doing night shifts for quite a long run. And it was before they had a limit maybe on the number of night shifts. They've got made that shorter now. Um, I think even my, generations before me, it was even longer, the runs of nights you could do in a row. And then it got shortened a bit for my generation. And I think it's been like shortened again since. But yeah, you could do end up doing quite a run and, quickly clock up those hours. And that was really tough because it didn't feel less than full time with a baby at home. And as I said, I haven't mentioned, but I had some other things going on. My husband's health wasn't very good. So yeah, so it was a tricky time for me.
Mm. It's like that environment just lacked compassion and maybe the humanity side of things.
Yeah.
Taking into
Yeah.
consideration what you are going through in your
Yeah. And things like, emailing ahead to the next rotation. So my husband won't mind me sharing this, but of course, I'm not saying that every situation like, was terrible in the NHS. There were some really good times as well. And I did make some really good friends. And there were some lovely seniors who were really good to me. It was just different rotations. And I don't blame anyone because it's the pressure of the NHS. Like they're struggling with the rota, therefore they're feeling the pressure. So that's why it's kind of ended up like this. I don't think it was ever anything particularly personal. It
Mm.
was just the system, if that made sense. It
Yeah.
was pressure. So I would never want to I'm never going to criticize an individual particularly for anything. It was just everybody was under pressure. So in that system, like, of course, things are going to be, the compassion's going to go, the empathy is going to go, and everybody feels like, well, I'm having such a tough time. So you kind of just sort of expected to get on with it. Do you see what I mean? So
Mm,
yeah,
mm,
that's how it felt. But I was about to say was my husband, yeah, he at the same time. So my situation was probably a little bit more pressured than some, but everybody in life has challenges. And so, the NHS will have hundreds, probably thousands of people with lots of challenges who are working really hard in the NHS and have stuff outside of work. And that has to be allowed for a little bit. There has to be some, compassion there. And I think that's what I found hard was so my husband, he had multiple craniotomies, so brain surgeries during my training. And they started when I was at medical school. Well, actually, the monitoring of his brain tumors happened at medical school. And then his first operation happened about 6 weeks before my daughter was born, my first child. And that was tough. And he had a bleed on the brain. Um, wasn't able to walk after that operation and ended up in a rehab hospital for a little bit.
mm,
And I was also on maternity leave at that point, but that was not the kind of start to maternity leave that you kind of expect. I don't know what you expect, but it's difficult anyway.
yeah.
And but at the times, I wasn't actually particularly, I don't remember feeling stressed. I think I just powered through because that's what I'd always done. I just powered through and I powered through and just kept going. So yeah, so I don't remember feeling stressed, but obviously it must have been taking its toll on me over time. Anyway, fast forward, he's over the last 10 years, he's had multiple brain surgeries to remove multiple meningioma. Now, meningioma are benign brain tumors, but they grow and obviously in an enclosed space, so they do cause problems. Um, and that, unfortunately, he's got those because he had treatment for leukemia as a child that the long-term side effect of it was these meningiomas. He also went on to have thyroid cancer, so he had his thyroid removed during one of my second maternity leave with my second child. And we moved house at the same time. And I was training in my final year as a GP and studying for exams. And we had a bereavement in the family, and a close friend of my husband's died as well. And I think all of that just layer upon layer upon layer upon layer, and then the lack of compassion at work, even though they knew that some of this was going on. In fact, they knew pretty much most of it was going on. It broke me, if I'm being honest. And so it wasn't just my husband's stuff, and it wasn't just work, but it was just that combination of the two. But yeah, I felt guilty almost for like it having an impact on my work, but it ended up that actually I ended up having to take quite a lot of time out. But it was the best thing I ever did, and it changed me forever and for the better. So yeah,
So you had to endure a lot just as a doctor in that system.
yeah,
Also lots of other things going on for you, and it
yeah,
all just it was just too much to deal with
yeah,
then. So what were some of the things that you told yourself during this time? Like you said, you felt guilty that
yeah,
you weren't able to show up for work
yeah.
as you could, but what else was going on in your thoughts in your mind?
It was always guilt from my colleagues, but most of my colleagues, my actual peers, were really lovely about it. It was actually more from the senior like team often. Um, but I was also like, well, I think from my earlier junior years, before my husband had his operations, um, there was this sort of feeling that if I spoke up about anything, it was probably best to just keep quiet and get on with it. That was kind of the feeling. So I just got on with it. So that's what I kept trying to do. But unfortunately, my own health, started to become damaged with it. Not just mental health, but physical health as well. And I did burn out. But I think when people hear my story now and when I say it back, and I summarized it very quickly there, um, I do think, God, if someone told me that story, I would be like, it's okay that you weren't okay. Um, and time out was probably what you needed a long time before that. But yeah, and I just kept thinking I have to keep going. I've got children who are responsible, who are dependent on me. My husband, he had times in between surgeries where he was better and stuff, and he's the best husband in the world. And I'm not just saying like he's so good. And I've had some health issues recently, and he looks after me so well. We're a good team together. And he's so supportive of everything I do. Yeah, he's just brilliant. But at the time, I was obviously felt responsible for him and making sure he was okay. And, I've got all the normal things that people have in their life. So, other family members perhaps not being well out in the extended family or aging parents, and just the other usual day-to-day stresses, which became like they weren't that big a deal to me at the time, but actually they were all probably chipping away as well. So yeah, so it was a lot. So I felt a lot of guilt, a lot of responsibility, but I also felt this kind of until I burnt out, I felt like it was you've just got to power through, Jane. There's just just get on with it, like just suck it up, kind of thing. But that is not the approach that I would take now, and not something I would recommend to anybody.
Mm.
Um, yeah,
But
your health is your wealth.
I mean, it's often how we've been conditioned, or in
Yeah.
certain environments, been conditioned to think in that way. You just power through, feeling guilty. I have to show up in the best way possible. But when did you know? Was it when, burnout happened for you? Was it because of physical symptoms that you had to stop, or was it more a decision? I'm taking time off.
No, so what happened was I don't think I'd really kind of clocked how bad, like how much I was struggling really, until what happened was my back actually kind of was causing me a lot of problems. And I ended up taking some time off, just a short period, I thought initially, to because of this back pain. It was really severe, and I just thought, oh, just mechanical back pain probably, but I was super sore, and I couldn't have sat at work or driven to work or anything at the time. So I was like, I've got to get this sorted. But I kind of thought I'll be off for a week, so I went to the GP. But I think when I went to the GP and I spoke about it, and I was talking about it, and they obviously knew quite a lot from our family stuff that was going on. And I ended up just kind of, I think I did burst into tears and just blurted out a lot of stuff. And they were like, are you actually okay, Jane? And they said, why don't you take a little bit longer off? So they, signed me off for another week. And then what happened was, I think my husband and I realized that I was struggling more. I was kind of very low, um, mentally, but also was having this physical pain of my back as well. But still somewhere inside of me, I knew sort of the thing to do to kind of to try and make myself better was maybe see somebody, or so I'd take myself to the doctors, but also maybe talk to somebody. So because of my husband's health problems, we had access to Maggie's, which is the cancer centres over here in the UK. They're all over. The first one ever made was in Edinburgh, so that was kind of like the first one. So I, as a doctor, having worked in oncology, had experience of visiting it when I was there, and I knew it was a really good service. And so my husband was struggling as well, and I'd been trying to persuade him to go and see them. But we went as a couple. We went as a couple in together, and I kind of at first thought, oh, it's more for him than it is for me. But actually, when they heard our story and they sort of saw how I was, the lady turned to me at Maggie's, who was speaking to us, and said, Jane, you need to take a lot longer than just 2 weeks off. I think you need to start with probably at least a month or two, if not more. And then she was the one who said to me, it's okay that you're not okay and you've been going like this for too long and you need to rest and look after your body. And I think it was someone giving me that permission to say, and they were just taken aback, and they must have heard a lot of difficult stories. They were really taken aback by our journey. I remember the lady in Maggie's writing down our story in a notebook as we started, and we were there for an hour. We had an hour appointment with a lady, and she was like, I wouldn't have started writing if I knew how much there was, because she's like, this bit of paper isn't big enough.
Mm.
And she was taken aback by how much we'd been through and how strong we'd been for so long. And I guess it was like, even now I feel a bit like, oh God, I don't want to feel like poor me. But at the same time, I'm like, well, actually, if it was somebody else's story, I would feel, like that was a lot. So I think there'd been this feeling of, oh, there's always somebody who's worse off, and there probably is. But that doesn't mean it's not okay to it's all relative to your situation. Do you know what I mean? And it doesn't mean that it's not okay to feel not great about it.
Mm.
Um, so yeah, so she kind of gave me permission, and that was when I was like, actually, yeah. And I realized I was quite burnt out, and I ended up being off for 6 months actually.
6 months. Wow.
Yeah.
I know
So yeah,
hindsight is.
yeah, and it's crazy because I thought I'd be off for a week or two with my back pain, but then I realized, yeah, it wasn't just about the back pain at all.
Mm.
Um,
If you look back now to that situation and with the wisdom that you have today, how would you have dealt with it differently?
oh, that's a tough question, because I don't know how much I could have changed about what was happening at work. And like I said to you, working, if the system was the way it was now, I would have worked less. But it was hard because obviously my husband wasn't working either, so there was also a financial responsibility.
Mhm.
But I do have a very supportive family. My mum and dad, who I've mentioned before, worked incredibly hard and came from nothing and built up, did become quite successful with the business that they had. I know they would have supported me, and do still do support me emotionally and everything. So I think I would have tried to work less, but it would have been borderline between, can I actually reduce this to a level where financially it's actually possible? There were times when I thought, I can't continue GP training, and I'm almost like not making enough money to kind of actually fund my family, and I'm working and I'm burnt, I knew it was stressful. I wasn't calling myself burnt out, but I knew it was stressful. And I was thinking, is this compatible with my life? Like, can I actually do this career? And it felt, I'd been doing it for so long, to give it up, was a hard thing. And I kept thinking, well, there's an end point where it won't always be like this. And if I become a GP, I'll be able to work more flexibly, which is true, because I locum now as a doctor. So I kept thinking, well, there's an end point, there's an end point. I just need to get to the end point. But in that process, it just really took its toll. So I think going back, and with the system the way it is now, I probably would have worked a bit less.
Mm.
Yeah.
Mm.
And it's hard at the time. And as a mum, like, I'm sure you can relate. It's any mum out there can relate. It's really hard to prioritize yourself, especially in those sort of circumstances. Everybody was dependent, or it felt like everybody was dependent on me.
Yeah.
Maybe that was my perception, but a lot of people were. With two children, my husband were dependent on me, and my patients were dependent on me. My job was, they needed me to show up. So I think it's really hard, but I would try now, having done all my health coaching and everything, I would try a lot harder to put myself first. Just a little bit more even would have probably made a bit of a difference, and try to look after myself a bit better, because at medical school, as much as we're taught a lot, we weren't taught a lot about nutrition, and and I knew what was healthy and not healthy, and most people do, but I think I always just thought it'll be fine for now. So I probably didn't eat as well as I should have. And I
Yeah.
certainly didn't have time to really exercise properly or anything. And I
Yeah.
think those things I would probably now tell myself, no, they're more important than anything else. That's what I probably would try and say. Yeah.
Absolutely. Yeah, those small things, they add up in the end. Have you ever wondered whether you could turn your interest in health and wellness into a meaningful career? At Health Coaches Academy, we train people just like you to become professional health and wellness coaches through our Level 5 diploma. It's a 12-month part-time course, fully accredited, and designed to give you the skills, confidence, and practical knowledge to help others transform their health while building a career you love. If this sounds like something you'd like to explore, visit healthcoachesacademy.com. Now, back to the show. But what is it that you would like the world to know about burnout? Because I think there maybe are some misperceptions when it comes to burnout. So what is one kind of message about this that you would like to get out there?
Oh, the people, it's like a sustained pressure that kind of creeps up on people, and that it's not their fault, first of all. It's
Mm.
not their fault. That's a big thing. Um, and it's okay to ask for help.
Mm.
And actually, I would encourage leaders or senior people in teams and managers, and certainly this is something I'm championing a lot at the moment. Workplace well-being is something I'm kind of looking at a lot more in my coaching side of things, which I can talk about in a wee minute. But um, is asking people, are they okay? Not waiting for them to be broken before someone's actually looking out for them. So I think a big message for me would be, if you think or have a hint, have a small inkling of a feeling that something is wrong, ask them. Ask them if they're okay, It might be the first time somebody's done that, or it might be, and they might not open up to you the first time and they might say, I'm fine. But I think if anybody had ever asked me, and that's not true. I did have some supervisors in certain posts who knew about what's going on and were very nice, but they couldn't change the system. And that's why I would say I would never blame an individual in the NHS, because it was kind of the system as well. But and on some of the jobs, there were people who definitely didn't ask if I was okay ever. Um, and I think I could have done with that. That would have been a good thing. That would have been a good thing. I'm not saying they could have fixed everything, but knowing that someone was aware or cared would have been huge. So yeah, I think asking someone if they're okay at work, or if you can, that's really important.
Yeah, and it's okay to ask for help. It's not your fault, but also
Yeah, those messages. Yeah,
other people reaching out to you before you necessarily get to breakpoint could
yeah.
be valuable.
And I
Mm.
think I think from like the workplace point of view, like that's what I think needs to happen more. The NHS is a huge system. So, but like in any company, the preventative approach rather than the reactive approach,
Yeah.
because I may not have needed 6 months out had I have had a different path.
Mm.
Um, and yeah, I think, yeah, it needs to be more of a preventative approach is what I would say. So I think asking for help, but people in the company saying to their employees, do you need any help? Really important. And that it's not their fault is huge. Yeah, absolutely.
How did this journey eventually lead to health coaching?
Yeah, that's a good question. So, um, so what happened was when I was doing GP training and just finishing up. So that was during the end, sort of, because I'd had gaps out, obviously, with the 6 months, and I'd had maternity leaves, and I had worked towards the end of my training. It was easier to work less than full time in GP practices rather than the hospital rotations. So I was working a bit less. So it took a while. So the last part of my training was actually just towards the end of the pandemic. And I think I was kind of like, as I was entering into being a fully qualified GP. So I've been a doctor since 2011, but being a fully qualified GP, I was kind of like, I loved it, but I was getting frustrated. So I'd had my own burnout as a result of work and life pressures. And I was treating patients with all these kind of chronic diseases, so diabetes, blood pressure, cholesterol, high blood pressure, um, difficulty with weight. I had struggled with my weight. So that during that burnout period, I had always been very slim pretty much most of my life. And obviously age and post having babies and stuff maybe contributed a bit, but pandemic as well, but also my burnout, I ended up putting on a lot of weight and I just didn't feel very good about myself. So although my mental health had improved after having time out,
Mm.
and that was definitely the first step for recovery, my physical health I felt wasn't so good. And I was still, mentally I was better, but I still had a journey to go on. I still had a way to go with my mental health. It's something you need to maintain. It's like physical health. It's not like, oh,
Mm.
that's it. I'm better now. I can go back to what I was doing before and I'll just burn out again. You have to maintain it. So I was always still trying to maintain that. And I just saw my patients, but also myself and thinking, there's got to be a better way. Like I just was feeling like I was handing out prescriptions and medicines and hardly having time to really say anything about lifestyle. And yet I just had this experience where I knew how important that was, and was feeling just really frustrated in my consulting, but my own life, that I needed to do more to look after myself in a different way.
Mm.
And although I was a doctor, it was like, it seems silly that like I just needed more guidance with that. Like I needed more support with that. And I think that's the thing, is realizing that everybody needs support, and it
Mm.
isn't all about the medicine. It is, medicine's great, and we do need tablets and medications for certain things and surgeries, etc. And modern medicine is fantastic for that. But some of the basics of just living a healthy life and how to do that, it was a bit like, I felt a bit lost. Felt a bit lost. That sounds really silly, but I felt a little bit lost. And I just needed more guidance. So yeah, so I started looking up, and I also wanted to make sure my life had balance because of what I'd just been through with the burnout. And I knew, if I'm being honest, I don't like criticizing the NHS. I know I've just said some stuff that was really difficult about it, but there are lots of good points about it. But I also knew that if I stayed in it in the way that it was and continued as I had before the burnout, that I would probably burn out again. So I kind of wanted to look for something that gave me balance. So I wanted something where I could maybe work from home. I could do something different. I had more time. It still involved helping people, but I had more time with those people. And I didn't want to give up GP,
Mm.
but I definitely wanted something else in maybe the same field. So I started looking for something to help myself, really, but maybe thinking, could I use it in my GP? Could I use it somewhere else? And I'd had one teaching session on something called lifestyle medicine towards the end of my GP training. And that had introduced me to a society called the British Society of Lifestyle Medicine. And their conference that year happened to be in Edinburgh, like 10 minutes from my house. So I went along to that and I was like, wow, this is amazing. This is absolutely amazing. Like, why isn't everyone doing this?
Mm.
Um, and I kind of thought, and they had a course at the time, which I think has evolved and changed whatnot now. So, I'm not dissing their course. I haven't done it, so I can't comment really on it. But I felt like it was very knowledge based and less application at the time. I think now they actually have introduced some coaching elements into it. Um, and also at that time, I think you had to pay in one big lump sum, and I couldn't because of my family situation. So I was looking, and I kind of wanted something more practical, like where it was really practical. I didn't want just the facts, because that's the thing. I felt like, well, that's all I've ever had is the facts, and then I hand them to people or I say them to people. That doesn't mean anyone takes action. I
Mm.
wanted something where actually, you change people's behavior. I changed my own behavior. I need to change my own behavior. So that was when I started looking for different things, and I found Health Coaches Academy. And it was perfect. It was absolutely perfect. I just thought this is it. I spoke to Sarah, and then I signed up. I signed up pretty quickly after I spoke to her. And I just thought this is exactly what I've been looking for. And what I loved as well was that the course guided you into actually setting up to practice, not just leaving you with the qualification at the end with the knowledge and the tools like of coaching, but like actually helping you set up. And I think that's probably what, really kind of got me. I was thinking, well, I need that because I'm a doctor. I've never done business. I don't know how to do anything to do with business. I mean, my whole family are business people, but I had never done it. So I kind of thought, yeah, that's for me. And it was the best decision ever. Yeah.
Did the course help you to make those changes, the much needed changes?
Yeah, it did. It's helped me. Don't get me wrong, I'm still on a health journey. Like I say, you've got to maintain your physical health, you've got to maintain um your mental health. So I'm not perfect, I'm human.
Yeah.
And I don't try to pretend to anyone that I'm otherwise. But I've made lots of positive changes in my health. And I think probably the biggest is that my health is my priority, that my mindset shifted.
Mm.
And it definitely helped me shift that. But
Mm.
yeah, I mean, loads of little things like, I mean, they all add up. So I used to drink, I've got my little coffee here, but it's decaf. So I don't drink caffeine anymore at
Yeah.
all. And I probably used to have like at least two Diet Cokes a day, probably a cup of tea and maybe two coffees, So I had quite a lot of caffeine before. I drank Diet Coke my whole life. I don't drink it at all now.
Mm.
Um, what else? I used to drink orange juice with breakfast every morning. I don't drink that now. I just have water. I used to eat far too much mango, which sounds crazy, like, oh, that's fruit, but it was super sweet. I
Mm.
didn't necessarily always have protein with all my meals, that kind of thing.
Mm.
I think my blood sugar is probably a lot better. Well, I know it's a lot better balanced because I've used, a CGM to check it out since then. Um, Sorry for anyone that's a continuous glucose monitor, but yeah. So yeah, I've used that. Exercise, yeah. So I'm much more consistent with my exercise. No, I will be honest, recently, so that back pain that actually I had back then and thought it was just a mechanical back pain ended up being actually an autoimmune condition. So I did have a more serious health issue. And that has sort of hindered my progress a little bit this year, but so it slowed me down in my journey a little bit. But I think the thing is, again, is that the priority has always been, well, this comes first, my health comes first. So I don't do anything that's going to make me worse, in terms of work, for sure. Um, I'm not going to lie, there's some times where I suppose it's, things like in the past where I would have maybe reached to have a takeaway because I'd be exhausted and I'm sore and I'm tired and I would have come in from work, say as a junior doctor. Now, because I batch cook, it might not be a perfect meal. Like it might be, well, it'd be like something like spaghetti bolognese or whatever. But
Mm.
instead of white pasta, it's wholemeal pasta or it's courgette instead of pasta, so it's all these little things. And my husband and I, and he really got on board with it as well. So he does a lot of the cooking and he's really on board with that. So we batch cook. I'm not saying we're perfect. We don't do it we're not religious as in like, it's every Sunday we do a big batch cook. But I'd say at least once a month we try and do some batch cooking,
Mm.
and always have something like that. And it's so handy for the kids. And it just means when I'm tired, I don't tend to reach for the wrong thing. Do I have treats? Of course, occasionally I have treats. But I am trying to be more and more careful with my diet, especially because of this autoimmune condition. I notice if I drink any alcohol, I'm definitely more sore. So I don't really drink anywhere near what I used to. Just kind of, yeah, more sort of special occasions or an evening out maybe, but at the moment actually not really very much at all. Things like that. And obviously exercise. So I joined the gym during the Health Coaches Academy course, and I was having PT sessions regularly. That did stop just recently, but I'm actually going back next month just because I had a bit of a kind of pause while I was on new medication and things. But yeah, so and that's the thing is, I think that's probably the biggest thing, is that whenever I have a pause like I've just had recently, in the past it might have been a super long time, or I wouldn't have seen a pathway to getting back on track. But now I'm never scared when I have a pause or
Mm.
something doesn't quite go to plan. I'm not as scared by
Mm.
that. I'm not kind of giving up because I know I'm not giving up. It's not a giving up or carrying on kind of thing. It's more just a this is my life. I'm having a pause. That's okay. I'll be back on it soon.
Mm.
And I think that's it. I don't have that scared kind of feeling of, oh, well, I'm obviously going to regress so much that it's going to be terrible again. Like that's not going to happen. So I think it's mindset, it's habits. I mean, actually, as well, I've recently put and because I wasn't going to the gym as much recently, I thought, well, I still got to do something. Like I still want to do something at home. So I do stretch a lot and kind of yoga type stuff at home while I haven't been going to the gym because that was a bit more gentler for my body. And then I've put small weights next to my kettle. And
Mhm.
every time I boil the kettle, I, do some form of kind of bicep curls or whatever.
Mhm.
And it's the small things, but they add up, and that's what I always say to my clients now. They make a difference.
Yeah, they do. It's not about doing everything perfectly well, but like you said, it's the mindset, your mindset that changed about prioritizing your health that comes first. Uh,
Yeah.
but also a pause does not derail you anymore. In the past,
No,
it would have been
absolutely.
something that, oh, okay, I might as well just give up. But now it's like, no, I can just start again.
Yeah,
Um,
that's it. Exactly.
the course meant a lot to you personally, but are you
Yeah.
also using it today? Are you combining the GP work with coaching, or what does your work life look like?
Yeah, absolutely. I'd say I'm probably doing more coaching now than I am GP, but I do both still. So I was in GP yesterday, but I was coaching the day before that. I'll be coaching tomorrow. So I do a mixture now. So I do one-to-one coaching with private clients and mostly online. Um, and then I was running and still am running, but I haven't got a current group at the moment running, but I have run quite a few group coaching sessions. So that was for groups of 6 to 8 people. It was mostly women. It had a kind of weight loss slant because that's been my real struggle and still is. It's not a struggle, but it's my journey. That's probably a big part of it. But I don't, again, now I don't pigeonhole it as weight loss. Like I don't really like doing that. I suppose from a marketing point of view, that's what I sort of say to my clients. That's what, if you're interested in that, but actually it's a whole health journey. I do emphasize this isn't a quick fix. I never lie to people, like it's a longer journey. Um, So yeah, so I'd run groups for 6 to 8 people, and that was like an 8-week program online that people could do. And I will run those again. I just having a bit of a pause at the moment. I've actually just advertised a slightly shorter length group to support people on GLP-1s, which I literally launched yesterday and I've had a really good response to. So I think that's going to be starting in May. And I've also moved into the corporate space a bit now. So I'm working with companies going in and doing kind of different talks, workshops or pop-up clinics. So yeah, I've been into a few up here, and then I recently exhibited at the Health and Wellbeing at Work at the Birmingham NEC in the UK. And that's what I was referring to when I was talking about that preventative approach. And kind of, I had a lot of conversations at that conference with occupational health providers who maybe provide the standard employee assistance program type package. And actually, a really senior director of a big occupational health provider was like, he was talking to me and I was explaining coaching. And he said, I think that maybe we're missing a trick here. Maybe we need to be coming in earlier with coaches. And I was like, yes, absolutely. So it was great to have some of those conversations with people who are doing, who are looking after people's health. So yeah, so I'm excited for that. And I've made some really good contacts and I've got some companies, hopefully, that I'm going to be working with out of that exhibition. So that's exciting.
It's amazing, Jane. Wow, you've done so much in the meantime.
Yeah. I know. I feel quite because I sometimes think, oh gosh, again, that old mindset can creep in a little bit of like, oh, I could do more because I've been a bit unwell with this autoimmune condition. But I think actually for my first, it's just over a year and a half since I started Better Health with Dr. Jane, and actually considering everything and the health struggle I have had a little bit this year, I actually feel quite proud of where I've got to. So
Absolutely, you can. Yeah. You should feel proud, yeah. So you've got these two different modalities. Let's say you're working as a health coach, but also as a GP. Do you also feel like the health coaching is shaping the conversations you're having as a GP?
Yeah, absolutely. When I can. I mean, obviously, in 10 and 15-minute
Yeah.
consultations, it's hard. I mean, yesterday a lady came in with a chest infection, and I just was like, oh, I was so wish there was so many things I wanted to kind of say.
Yeah.
And if I could, I'd probably be there with her for an hour, but obviously I haven't got the time. But if somebody comes in and it is very much a lifestyle related condition, um, or they're coming in, people come in to talk about their weight, especially with all the GLP-1 stuff that's out there, so the weight loss injections and stuff. But even before that, they would come in to ask to be referred to weight management and stuff. So yeah, absolutely bring it into that. And I've done like as quickly as I can, maybe a brief kind of, the the diagram that I always remember from the course, and I still use very much in my explanation of blood sugar balancing, the kind of ups and downs, the peaks and troughs,
Yeah.
and showing people like what that means and in terms of their diet, how they can impact and change that to be more steady. So I will bring it in, and that's obviously not just for diabetics, that's for everybody. And I have had some, patients, one who reached out to me and found me on Facebook, through my private work. She found me. She's not my private client though. She was a GP client. And she had said that she'd lost like 10 kilograms through just the 2 or 3 consultations we'd had
Wow.
in GP from the few tweaks, which was so lovely to hear. So it's harder, but I think being a health coach makes me a better GP, and being a GP gives me, I suppose, like
Yeah.
a different viewpoint of everything from being a health coach, so I kind of think they really complement each other.
I think it's a lovely combination. I agree. They really support each other quite well. So, are there any last thoughts that you maybe want to leave our listeners with before we end off?
Um, well, I suppose in terms of your listeners, in terms of anyone who's thinking about becoming a health coach, uh, yeah, do it. That's what I would say. If not necessarily even for business, but for your own well-being, it's brilliant. But if you're doing it with HCA, they absolutely will support you to make a business out of it. The hub and everything afterwards, I still use that. I'm still a member of that. I still use the resources from that quite a lot. And I love all the, events that are still put on. So from that point of view, like those listeners, from listeners who are listening from like just a health point of view, like it's okay to not be okay, is what I would say. Ask for help. So yeah, those would probably be my two things. And I suppose as well, like not being frightened to think about, because it was a big decision to maybe move a little bit away from GP for me. There's probably quite a few medics out there or healthcare professionals, nurses, physios, who might be thinking about it. And I think you don't have to give up being a GP. You don't have to give up being a doctor or a physio or a nurse. You can combine the two. So, because it's a big part of our identity, you know, and I think that was like a lot of the time when I was in medicine, it was like, oh, I can't give this up. I can't give this up. And I didn't want to. It's just the system was hard. But now I locum, so I kind of practice in the practices that I would choose to at the times that suit me. I often, like yesterday, I did a one, and they needed a doctor at quite short notice. And they said, you know, because we need you at short notice, that we can make it really flexible. And I said, well, actually, I can only start at this time and finish at this time because of school drop off and pickup, but I'll see the same number of patients that you want me to. And they were like, yeah, that's fine. And actually, because of that, that works more flexibly. So I kind of feel like that I can fit into the system a bit better that way. So yeah, so actually, like, and I know that might not be the case for every healthcare professional, but if certainly in GP for me, I can make it work. So yeah, and I think probably a lot of them could, you know, combine the two quite well. And it gives you that different perspective, you know, that holistic, that really whole person perspective, even more than you may already have. So yeah, so any healthcare professional thinking about it, I think I would say don't be frightened to make that shift because it doesn't mean having to give something up.
I think that there might be lots of resistance there to give up your identity, especially as a health or as a GP, as a doctor. But like you said, it can be combined in such a way. Yeah. If someone's listening today and they want to reach out to you or they want to find out more, what would be the best way to do that?
So you can go through my website, which is www.betterhealthwithdrjane.com, or you can email me direct at drjane@betterhealthwithdrjane.com, or I'm on all the social media channels. I'm on LinkedIn, TikTok, even Instagram and Facebook. So any of them. And I think the links to those are all on my website. So yeah, they can reach out on any of those channels.
Thank you so much. I think there's a lot that I got from today's conversation. I think, you know, knowing that you can reach out, it doesn't have to be like this or wherever you are at right now. And sometimes it's the best you can do in a certain situation. But I think creating systems to also support people and be proactive instead of reactive could make such a big difference. And
Absolutely.
you also specifically, you built a life that currently doesn't cost you your health. So thank you for reassuring us that it is possible, no matter how stuck you may feel. There is always a way forward. So thank you for sharing your own journey with us today, Jane.
It was my pleasure. My pleasure.
Thank you for listening. We hope you enjoyed this episode. Please feel free to share it with friends or family who might find it inspiring. And if you'd like more insights like this sent directly to your inbox, make sure to sign up for our fortnightly HCA Talks Health newsletter. We've popped the link in the show notes. See you next time.